Welcome to It's Beyond the Food podcast. I'm your host, Stephanie Dodier, non-diet nutritionist and founder of the Non-Diet Coaching Certification. This is Beyond GLP-1, the Expert Series. I created this series of podcast episodes because informed consent required the full picture, not just the press release. So over the next several episodes, I'm bringing in experts to cover every angle: science, marketing, side effect, impact on body image, nutrition, health, counseling, and what all this means for you and your client. Whatever you are, a health professional navigating these conversations in your practice or someone personally researching your decision, this series is for you. Ready? Let's do this. Welcome to the podcast, Marci.
Thanks so much for having me, Stephanie. I've really been looking forward to this conversation that we're going to have today.
And it's a very important conversation, the other side of GLP-1 and body image and eating disorder. But first, I would like you to introduce yourself because you have a long, very powerful bio. So how would you introduce yourself, Marci?
Probably introduce myself a bit differently than how an official bio is
Yes.
written out. My name is Marci. I use she, her pronouns. I am really energized by these types of conversations. So again, so appreciate the invitation. I am a registered dietitian. I have been practicing eating disorders care since really the very beginning of my career, and have been, I think, a bit unique in that while I had a kind of traditional dietetic training, weight-centric training, very early on was introduced to the concepts of intuitive eating and actually found myself down a rabbit hole of weight inclusivity and body acceptance. And so I didn't have to ever do kind of a big pivot in my career. I was really fortunate, I think, in many ways to have that pretty close to my foundation and my start. So I often make the joke that I'm a one-trick pony. I do many different things, but I have a singular trick, which is eating disorders work. And I appreciate you probably have listeners who come from the lived experience of recovering from an eating disorder or maybe eating disorder professionals. But I also hope the conversation we have today feels inclusive of people who maybe don't identify with that diagnosis. Maybe they have a history of, disordered eating or, just kind of wrestling and inundated with diet culture. But there are many different things that I do with my eating disorder hat. I am a clinician still. I have a clinical practice. And I feel that at my heart of hearts, I am a clinician. I love, love, love the work that I get to do with my clients. I'm also a clinical supervisor, which I also love. I'm also an educator. I teach graduate courses at Simmons University. Of course, I'm teaching nutrition counseling for eating disorders. And then the other kind of main thing that I do is clinical education. So for the past decade, I've developed online courses to help other clinicians and colleagues feel capable and excited about doing this kind of work. And as you and I were just, discussing before the recording started, I can share that after 5 years of intense work, I have completed a manuscript with my beloved co-author, Lisa Pearl. So we just submitted a book manuscript, which is expected to be out late fall 2026. So that's probably enough, but that's me in a nutshell.
And I'm going to say for the audience, I've taken some of Marci's courses, and she has a brand called Body Image Healer. That's how I came in contact with you. So we're going to focus our interview on body image and eating disorder in this new world that we have GLP-1. So I'm going to just launch us with a very general question. You've spent your career working at the intersection, body image and eating disorder. What are your thoughts? What was your reaction? How are you thinking about GLP-1 right now?
We are in the midst of a major cultural shift. It is really a pretty profound moment that I think in some ways is a repeat of past moments and in some ways different than past moments that I think is a really intense time for people where being able to access weight loss in a way that feels easier and within reach in a way that it hasn't for many people. And I think it feels like intense pressure for a lot of people. That's certainly what I hear from many of my clients, that there is, because of the accessibility, because of the prevalence of GLP-1 use, because of the marketing, because of the intense social media, there is an incredible pressure that is surrounding them that is different than, say, bariatric surgery, when bariatric surgery was on the rise, maybe, 15 years ago or so. So it's a really particular time where we have the medication intersecting with capacities with social media and marketing. So honestly, I feel a lot of just tremendous compassion that we are all sort of thrust into a moment that I think we don't really know how to make sense of it and sort of how to manage it all.
And that's why this conversation is really important, because we're learning as we go. And I'm going to focus our conversation on body image. And I'm going to open with this question. The cultural narrative that people are being fed is that losing weight will improve their health, which we're not going to focus so much in this interview, but will also make them feel better about their body, will quote unquote heal their body image. What does this message assumption get wrong as a person who has this expertise in body image? Does weight loss improve body image?
I think that anytime there's a singular narrative, it can become problematic because, one of the things that I love about clinical work is that I get to be in the individual experience. And so anytime we're assuming that something will be true for everybody, it's not going to be true for a lot of people, and it may be true for some people. Now, as you well know, and as you've talked about extensively in your work, that neurobiologically, we are wired to want acceptance. That is built into our neurobiology. And so it is reasonable that some people do experience weight loss and feel significantly different about themselves, feel better about themselves. And a large part of that, not to say the sole determinant of this, but a large part of that is the social affirmation that comes along with that weight loss, right? And that is a true experience. People are trained in our culture to comment on appearance, to comment on size, and to have a values-based judgment, right? That smaller is better. And so that is very real and alive for people. But I think that it often is more complex, at least in my conversations with my individual clients, with my individual supervisees, right? So I'm thinking about one client in particular who, we won't get into the details of her experience, but decided to go on a GLP-1 as a result of a medical condition that she has. She's actually very strongly in recovery from an eating disorder. She did a tremendous amount of work around her own food and body image relationship for about a decade. The two of us worked together. She decided to go on a GLP-1. It has changed her body. And in some ways, that has felt really positive for her. And that's been actually quite complicated. But alongside that has been a pretty profound grief, a grief of the reality that she didn't really see a problem with her body before, but she realized that the world saw a problem with her body, and that as a young child, her parents saw a problem with her body. And so the reality that she is really confronting, appreciating that she doesn't really know, will her body remain this size? Will her body get bigger again? And will she be treated differently? Will the acceptance be conditional? And so there is this real tenuous relationship to all of the positive feedback that she's getting from other people, and that certain things are made easier for her. Clothing shopping is easier. She's having an easier time navigating public spaces, how she's being treated at the doctor's office. Like, those are real things for her. And for her, it's actually been in certain ways deeply upsetting because she sees in such a clear juxtaposition of the ways in which, for actually a lifetime of 40 years, how she had been treated previously. And she's really, to her credit, able to locate the problem not actually within her body, but within the sociocultural norms, the systems, the biases that are held outside of her. And so I think, my work with her has been such a great experience for me going through this process with her that it's actually been quite complex. I have another client who started a GLP-1. He has lived his entire life in what we would call a super fat body, and actually has gone on a GLP-1 for some medical reasons, some desires to lose weight, and he's not losing weight on this medication. And so what does that mean for him as somebody who, can see many ways in which his life might be different or made easier if his body were different? And so I just think it's a complicated place for many people when the notion is it is accessible, it is something you can purchase, it is something that you can access, and now seemingly everybody can have the body that they want. And of course, we know that it is far more complicated than that. And that's just, it's simply not true. It's not everybody's experience. And then, which I'm sure we'll get to today, the reality for some people who do decide to go on this medication for body changes and for whom it's incredibly detrimental in terms of their relationship with food and in terms of the, having an eating disorder, getting thrust into severe malnutrition, severe eating disorder behavior symptoms escalating, and for who these medications would actually be clearly contraindicated. And so it is, in my clinical experience, a pretty complex array of feelings, reactions, thought processing, grief, all of that. So I'll pause there and let you jump in.
I think it demonstrates the complexity of body image, right? What you're seeing in your clinical practice, that we think body image for general population is what we look in the mirror, and it holds so much more complexity than what we think it is. So if you had to describe what body image is, how would you describe it?
This is such a great question, Stephanie, and I like that you're asking it. It's one of the things that I do when I'm working with clients and when I'm sitting with supervisees or I'm running a training, and this, so you've taken my training, that's often the place that I begin in dialogue, because sure, we have academic definitions, we have definitions that are utilized in research, but I think the most important thing when I'm sitting down with someone, and that I would actually encourage your listeners to think about, is, well, what does body image mean to you? Because I think body image is really multifaceted. And I think that what it means for me as actually somebody who I'm, very conscious of having this conversation with you, my lived experience of having a body has been extremely privileged. As somebody who is straight-sized, who has lived with a degree of health. I've had my own, health challenges, but for the most part, significant health. Being somebody who is, cisgender, a white, female presenting person. And so, my own narrative and experience of body image being, of course, complicated because I'm a human, but in many ways made less complicated because I live in a privileged body. And so the way I think about what is body image, really what I think about is, what's the story inside of me and the lived experience inside of me of what it's been like to have a body? What has it been like for me to have a body? And that, we have the technical definition of sort of the image in our mind of, what my body looks like to other people. But I think that it is layered on with our thoughts and our stories and our narrative, our emotional experience, our felt sensory experience in our body. But I think more than anything, it's the cumulative lived experience of what it's been like for me to have a body. And in fact, when I really get in with my clients and are doing body image work, we often go back and I invite a narrative of, let's just allow you to talk about what it's been like for you to have a body. And what they're often surprised is thought loops that they live with day in and day out are often connected to experiences that they had when they were quite young and that they're carrying with them. And so that's, one of the ways that I think about body image. I think the amazing thing about body image and all its complexity is that if you had asked me 6 months ago or asked me 6 months from now, I'd probably give you a different answer, which I think is endlessly interesting.
And the answer would also be different, understanding the context of GLP-1 right now also, and will continue to be evolving and changing. When I was preparing for the interview, I was looking for research, specifically narrowing down GLP-1 and body image, and there's one. Like, so clearly,
Oh,
there's one, and it's a very
that's
small observational study. That's it.
thanks for sharing that with me. I have not looked at that study. So that I'm interested to know that there is a singular study. I'm interested in who's done the study, and I'll have to take a look at it.
Yeah, it's a very small study, and it was done from a body image researcher, which I think outlines a problem, right? And it
Mhm.
outlines the interview we did earlier with Louise, which is GLP-1 right now is marketed for weight loss, and that's where capitalist system will make money out of it, but it's not being researched. And we'll talk about body image and also eating disorder and the consequence of GLP-1 on body image. When I share with you that there's only one study and we're not looking at it, what are your thoughts on that?
Oh, I'm just not the least of all surprised. I think that, one of the things that I'm confronted with on a daily basis is that I'm I am so interested in my client's internal experience, sort of the consequences of, their relationship to food, like what we would see on the outside, right? How a person is presenting, how they're living, how they're eating, how they're behaving. And I'm really interested in knowing, but what is the impact on the inside?
Hmm.
And that is often not the priority of researchers. It's certainly not the priority of researchers who are primarily focused on a singular target, which is success is measured in weight loss. And we see this also overlapping in eating disorders research. It filters in all kinds of places. It's not just in the quote unquote obesity literature, that there is a narrow focus on, did the scale go down? And if the scale went down, then it's considered successful, but it's often not measured alongside things like psychological experience, emotional experience, sense of self-esteem, impact on, depression, anxiety, let alone eating disorder behaviors. And I think that also, some of these things are really difficult to capture in all of their nuance, in that a person might say, well, I'm less anxious. Well, I'm less socially anxious because I'm feeling better in my body and I'm being complimented. And also when I'm in there with my clients, we're talking about it, well, it it's it's a little bit more layered than that, in that, well, what if I lose the capacity to have this kind of restraint? What if I'm not able to maintain my prescription for this medication? I'm actually eating in a way that doesn't feel sustainable, but the benefits right now feel worth it to me. And so I'm often thinking about, well, what are the stated upsides now? What are the downsides in the short term, but what will this also mean for this person in the longer term? And that level of nuance and conversation is just not conducive to a randomized control trial. And so, our research is quite limited in that way. And of course, and if you had this conversation with Louise, that there's a particular agenda, and who that agenda is being fueled by, and who the narrative benefits. And so there's a real limitation to relying solely on published research. And I'm always asking the questions of published research: what questions weren't being asked, who's designed the study, what's being measured, what's not being measured. And it's one of the reasons why I love being a clinician, is because I actually get to get into all of that richness with the people that I'm sitting with.
And for me, it's also opening the space for us as practitioner to bring that forward to people that we work with that currently, like the side effect on body image, on mental health, on eating behavior, are not being measured, explored. And there is some consequence, and we need to bring that conversation with people that are thinking about GLP-1 or making the decision, because that conversation would not be held in traditional medical counseling.
Right, right. Absolutely. Yeah, that's exactly
Let's,
right.
let's talk about eating disorder because in my research, again, prep, I was like, okay, so there's only one research on body image. Let's look at the field of eating disorder, and it's the same pattern again. There's one research that was primarily focused on binge eating disorder, which was suggesting that GLP-1 were beneficial for binge eating disorder. Now, I'm not an eating disorder specialist, but I do know that there is a line of thinking in eating disorder treatment that weight loss is a solution to eating disorder. Where is your mind, your thoughts, your observation on that aspect of eating disorder and GLP-1?
Yeah, this is it's such a complicated topic in
Yeah.
many ways. And one of the things that I want to name as we're talking about this is that there can be almost two different conversations that we're holding, you and I, simultaneously. There's the conversation of how we think about this as a clinician, how I think about it clinically, sort of what my orientation is, what my ethics are, how I read the research, all of those things. And there is a related but slightly different experience, which is what it is like when I'm sitting across from somebody and I am in relationship. And I often strive to really watch my own agenda, particularly around the experience of body image, as somebody who does not live my day-to-day in a larger body, right? And so I am a very, very strident believer in body autonomy, but I also believe that body autonomy needs to be, if somebody is seeing me as a clinician, accompanied by ethical transparency of my understanding of where we're at in the research, where we're at in our understanding of GLP-1 medications, what we're seeing in the short term, what we don't know in the long term, so that my clients can really make thoughtful and self-reflective decisions about what they believe is going to be best for their bodies. And that while I might have a particular belief system, that I ultimately want to honor the fact that I know that my clients are incredibly smart. They are asking really important questions. And that while I can offer my perspective, my opinion, my clinical understanding, and this can get a little bit tricky in the room, right? That we might arrive at differences of opinion. And that means I can still respect them as thoughtful, wonderful, multifaceted people. And those are conversations that I am having alive, in my clinical practice. Now, I believe actually very firmly that trying to engage in intentional weight loss while trying to simultaneously recover from an eating disorder is not a way that I practice clinically. I think it seems like an maybe not impossible, but an almost impossible needle to thread, that I am going to somehow find a way, and I know that there are some very strong proponents of this, that it is possible to diet healthfully, to not diet in a way that is eating disordered. I don't quite understand how one
Hmm.
is trying to suppress their body size while they're trying to work towards making peace with food, fully recovering, nourishing their bodies in a way that is in alignment with health promoting body acceptance. And I really respect that there are people who believe that is something they can do. There are clinicians who believe that that is something they can provide. And so I do try to be very, very clear from the outset. If that is something a person is wanting from me, we're just not going to be a match. I just don't know how to arrange that in my mind. It's not something that makes sense to me. What I will say though is that I do believe that there is incredible variability in how a person's physiology responds to a GLP-1 medication. And is it possible for someone to be on a GLP-1 medication and be absolutely engaged in their eating disorder recovery? I do. I do. I have seen it. I witnessed it. I've been a part of that clinical care. But it is incredibly complicated because by nature of the medication, which alters appetite signaling, the question becomes, do they have access to hunger and fullness cues? And if they don't have access to hunger and fullness cues, Are they able to eat in the absence of hunger adequate nutrition that is sufficient to fuel their brains, sufficient to fuel their bodies, sufficient to fuel their recovery? Now, if a person with an active eating disorder is having a hard enough time doing that work with the presence of hunger and fullness cues, it's really going to be quite difficult to be doing that in the absence of an internal physiological drive to be eating. However, I do want to say, and I know that this maybe gets a little bit controversial in weight inclusive spaces, that I have also seen that there are individuals who have baseline metabolic dysregulation on a GLP-1 actually feel better access and greater clarity around their hunger and fullness. And so I try not to have a blanket statement of GLP-1s are always bad, or they're always harmful, or they're always going to put somebody into a more disordered state, because that actually hasn't been my clinical experience. However, what I will say in the eating disorders realm is that we are seeing more extreme behaviors, more harm than ever before, in a way that feels deeply frightening to me. It feels really scary. We have clients who are feeling unable to talk with their providers about their GLP-1 use, and so they're going underground, using GLP-1s off-label, not getting it from their providers, using it for months, being incredibly symptomatic in their eating disorder, having pretty profound medical consequences, very dangerous behaviors, and it's not being addressed. And then it's being condoned and marketed and celebrated in every other aspect of their life. And so there is a way in which, us as weight inclusive providers, I was talking about this in a supervision group I was facilitating the other day, is that we have always felt that we've been going upstream, going up the cultural stream. I've certainly been going against the normative stream in the realm of dietetics. And it's like the rapids have just gotten bigger. It's sort of like, how do we even have a hope of helping clients for whom a GLP-1 is going to be exceedingly dangerous, exceedingly harmful? And how do we make a case for that when the messaging elsewhere is so, so strong? Yeah, and I'll add on, Stephanie, I don't know what you're seeing in your clinical practice, but I have people who don't want to go on a GLP-1, who are feeling pressured, or who are feeling it's everywhere. And they're like, man, I've been working on my recovery for years, and now I feel even more pressure to kind of go headlong into my eating disorder with a medication. And I don't want to. That's not the life I want for myself. That's not the life I've been building. And so again, just kind of going back to what we've been saying, is that there is not a singular experience.
Okay, I have so many questions. I want to pick them one at a time. So what you're describing as a eating disorder where GLP-1 can be extremely harmful, I think is also what we're seeing in cultural social media, where we're seeing certain stars, we'll nameless them, presenting a very emaciated body and signs of malnourishment. And I think that's a great example of how GLP-1 can be a tool to actually severely, and we know that eating disorder is the deadliest mental health condition, to actually severely harm, if not kill, some people, because they're given a tool that is specifically give them the ammunition to deploy their eating disorder to the extreme.
That's exactly right.
And so you're seeing that in clinical practice as well.
I'm absolutely seeing that in clinical practice. My colleagues are seeing that in clinical practice. There are incredibly dangerous clinical situations that we have never seen before. I mean, really, really complicated, dangerous situations because of these medications. And that is not something the larger public is all that concerned about. I think the larger medical world, I think that it's just not a high level of concern. I think eating disorders are thought of as being so rare. So our sort of countering with, we are seeing incredibly dangerous practices This is harmful. This is deadly. This is enabling. This is giving the tool of anorexia to people. And I don't think that the larger medical establishment, certainly not the larger, you know, social media industrial complex, cares at all. And so that is something we are really up against. It feels as if we're sort of hollering from the rooftops like this house is on fire and people are kind of giving it a shoulder shrug.
And there's no screening requirement. That's my, like, the pony I go into right now. It's like there's no screening requirement for people being prescribed GLP-1. I think that's what we need to go after, like screening people before prescribing. What are your
Well,
thoughts
not
on that?
I totally and completely agree. I mean, absolutely, I can join you on that soapbox. It's frightening to me
Yeah.
that a medication that by design alters in the brain the appetite signaling, and that is thought of as solely a positive without any sort of inkling of concern. There is not screening, but not only that, Stephanie, and I don't know what you're seeing. What I'm also highly concerned about is that it's not screened and it's not monitored. It's
Yeah.
also given out when people aren't even going to the doctor for it. So a patient might come to their doctor and bring some medical concern. They haven't said, I'm looking to lose weight or I'm looking for a GLP-1. And so they're going in and then almost willy-nilly, the prescriber says, well, how about a GLP-1? I have a colleague for whom has some blood sugar dysregulation, is dropping into hypoglycemia. We're not talking about somebody who's pre-diabetic. We're not talking about someone who's diabetic or has PCOS, anything for whom we would think a GLP-1 sort of, we can understand the clinical rationale.
Yeah.
The provider said, maybe a GLP-1. Now, gratefully, this is a clinician who works in this space and says, why in the world would you be prescribing me a GLP-1? What is your clinical rationale for that? She didn't have one. So it is frightening, the fact that we have no screening, no follow-up, no monitoring, and a frenzy almost for which the medications are being offered and prescribed as if it is a panacea for anything that a person might be seeing a doctor for. I mean, the stories I'm hearing are, excuse me, I'm sorry to interrupt,
Yeah.
are almost unbelievable.
And I think you're seeing that in your practice. And for those of you who may not work in eating disorder, you're seeing it in the world of stars and social media. It's a reflection of what is being seen in the eating disorder treatment field.
Oh, that's exactly right. That's exactly right. I mean, the number of clients who talk about the ways in which they feel so activated by what is being seen with GLP-1 use among the stars who are using it for extreme presentations of weight suppression, malnutrition, is like handing a green light. You know, it's like, why would I not join? And I can appreciate the fact that it feels incredibly activating for many people who are trying their hardest to stay focused on eating disorders recovery when it feels like everything around them in such a profound way is giving a completely different message.
And it's being pedestal and it's being recognized. Are you seeing in clinical practice a difference between those that are on GLP-1 from a medical perspective versus those that are intentionally engaging for weight loss?
You know, I think that I have a selective sample size, we'll put it that way. You know, that to be fair, I have the profound privilege of working with individuals for typically very long periods of time. So I don't have the most typical clinical practice. So I have folks that I have been working with in their relationship to food, their relationship to body from a weight inclusive lens for many years. And so for individuals who I've been working with who've chosen to go on a GLP-1 medication for, a variety of reasons, there is a certain sort of compass that they have inside of themselves that, Marci, I want to sustain my eating disorder recovery. I don't want this medication to eradicate the years and years and years of work that I have built up, the trust that I have built inside of myself, the self-respect that I have, the way in which I want to nurture and take care of my body. So I have absolutely witnessed individuals who are choosing to use this medication and who are using it really in the service of their well-being. And I supervise a lot of clinicians who are seeing individuals who actually have been actively working on their recovery, decide to go on a GLP-1 medication. Hey, they want to lose weight because a surgery is being withheld and they haven't been granted the surgery and then they find themselves down a rabbit hole of rapid weight loss, of a resurgence of their eating disorder, of being thrust back into anorexia, of extreme malnutrition. And for certain people, because people respond to this medication differently, and it's quite scary because we don't know how a person will respond to this medication. For some people, it happens incredibly rapidly. And so there are people for whom they've been in their recovery for many years. Maybe they've even been solid in their recovery. They have very understandable reasons to want to access weight loss, reasons for which I do not hold any judgment around. And then they find themselves back in the throes of their eating disorder. But it's also giving them access to social praise, to medical care, to being treated differently in different spaces. So it's incredibly complex for the individual.
And I'll add to this, we're also just at the beginning of this, right? So people who are potentially seeing medical benefit will most likely not be on GLP-1 for the rest of their life because of financial insurance issue, because of medical side effect. So we don't know what the other side of it is either.
No, right. And that is what I try to hold in the room with my clients, with my supervisees, is can we hold that we are in the unknown and we're going to continue to step into the unknown, which is why I want the individuals that I work with to know that I actually believe that it's my job to be a support and a guardrail for their recovery and to be holding the red flag when I'm highly concerned, holding the yellow flag when I'm saying something that don't wait till it's red. That I'm really asking in detail what's happening in their relationship to their body, what's happening in relationship to food, really getting into the detail there so we can be watching out for, are we getting concerned? And I've had to have some, kind of difficult conversations with certain clients to say, how is it going to feel for you if you are losing weight and I'm not cheering alongside of you, that I'm not your weight loss coach, that I'm not celebrating with you? And I understand how that could be difficult because it's something that feels perhaps for them celebratory. And I've had to talk about why that is, that I see weight going up and down clinically for me to understand what might be behind those changes and for me to know and to talk through what it means to you, but that I'm not celebrating or in grief with you if the weight changes. Because the reality is, for many people, I may be working with someone who's losing weight now, and what happens down the line if they decide to go off the medication, if they can't afford the medication, if insurance has withdrawn the medication, and what we do know is the most likely outcome is that they will regain the weight. And I want them to know that I will be alongside them then, and that the way that I'm feeling about them and feeling about their body size is not something that is going to wax and wane, but that I am most curious about what it means for them. How does it impact their own sense of self? And I think that that can be difficult, but I think there's also, for many of my clients, a tremendous sense of relief and safety that they know that the way that I see them, the way that I understand them as people goes beyond the visual. But I appreciate that is not how the world treats them. That is very different than how they step out and experience the world when they leave my office.
And you're creating safety for them no matter what the outcome is, that you will always be there with them. And I think that's the safety that the world cannot give them. And I think
Right.
that's part of our role as weight neutral practitioner, but this is my opinion. So if there's a practitioner listening, perhaps not necessarily an eating disorder specialist, but a dietitian, a coach, a nurse practitioner, somebody that help support, counsel, treat general population, what would be your recommendation? And I know this is an entire course, but like in
No,
5 minutes,
I actually think we could say it pretty briefly. Yes, it is an entire course, but I also think it's actually quite simple, which is my hope would be that any clinician out there, provider, whatever setting you're in, is to not project celebration and success onto weight loss. And can you inquire rather than the assumption is, yay, we're losing weight. Well, if losing weight is happening because a person is taking a medication and they're no longer eating, or they're not eating well, or they're actually abusing their bodies, we don't want to accidentally join them in that. And so even just coming from a place of inquiry and curiosity, what has it been like for you in your relationship to your body since your body has changed? How are you feeling about yourself? Are you feeling differently about yourself? Are your interactions changing? How is it in relationship to other people? So that they have the room to have a nuanced experience, because most people are having a nuanced experience. And so I think that there is often, especially in medical settings, comments that are made without, and I don't think it's malintended. I think that these are social norms that have been built where there is an automatic, celebration or a congratulations or a compliment. But I think if a provider can actually be curious about what is happening for this person, what is their experience, how are they doing on a medication, what does the weight change mean to them, and to center the client's experience rather than a default to praise and compliments, I think that that would go a very, very long way. I don't know if you'd add anything to that, Stephanie.
well, screening. I think that's something outside of the dietetic world. When I talk about like general population practitioner, I don't think that the understanding of what disordered eating is or eating
Yeah.
disorder is, because there's a lack of screening. So they
Mhm.
are perhaps advising, recommending, and counseling, not understanding the full spectrum of the
Mhm.
individual in front of them because they're not trained to
Mhm.
do so.
Mhm.
Would be my recommendation, like more screening tool. And yes, there is a difference between eating disorder and disordered eating, but they still need to be brought into the conversation to the decision of GLP-1 and what the impact will be long term.
Mhm. Yeah, I think even bringing that into the room, that you mentioned very briefly screening tools. And, in clinical settings, of course, screening tools can be used. I think that a lot of the screening tools can be quite limited when we're having conversations about eating disorders, because people think eating disorder, and many people, even people who might actually meet criteria for an eating disorder, that doesn't sound right to them, or it just seems too extreme.
Treat.
And so even having a couple of questions that aren't necessarily from an official screening tool, but can you imagine if a medical provider said, hey, you started on a GLP-1, they significantly alter appetite. Do you think you're able to eat just basic meat, basic nutrition needs? Are you eating regularly? Are you able to have, 3 meals a day at a minimum? Do you feel you're taking care of yourself? We're worried about, particularly with aging, muscle loss, you know, loss of bone health. Paying attention and really demonstrating that you actually care more about a more complex picture of health than just the number on the scale. I think even that would be a pretty profound signal to individuals going to see their provider.
Broadening the conversation. That was my intent with this series, was giving the other narrative of what we need to be thinking about and careful, like broadening the conversation with the people we are working with beyond weight loss. What else do we need to consider? What else do we need to think about that you're not hearing in mainstream media and mainstream advice?
Right.
Opening that conversation so we can have a true informed consent.
Yeah, that's exactly right. That we can think about it beyond the number on the scale, and that when an individual is eating so little that it's translating to rapid weight loss, of course, as a nutrition provider, I am thinking about all of the hidden consequences, the ways in which that does impact lean body mass over time, skeletal health over time, hormone health over time, the ways in which appetite across the board sometimes becomes suppressed just in terms of desire and sexual appetite, social connection, feeling alive in the world. And so being curious about all of those different pieces rather than, and I think that that's the beauty of, as you know, being a weight neutral, weight inclusive provider, is that we are always seeking to see the full picture beyond what's solely happening on the scale.
Yeah, we're seeing people beyond the physical body. I always say, like, you're more than a physical body, and that's why we work together. Like, you're an
Mhm.
emotional, mental, spiritual, and that's where we're going to bring the conversation because for years you've only been treated as a physical body. How about
That's
if we
right.
do the broader spectrum? That conversation, like medically, counseling wise, is never talked about. And like you go to your physician, we'll never talk about mental, emotional, and spiritual well being. Someone needs to have that conversation with our client and patient. And that,
Yeah.
to me, that's us.
Yeah. It's one of the many reasons I love my job. I think that primary care providers, at least here in the United States, because that's what I know, are in a very difficult position in that they are required to see very high volume of patients in a very short period of time. They're tasked with responding often to a number of different challenges and issues that a person has, and they're meant to sort of resolve those issues pretty quickly. So I really feel for the constraints that our primary care providers are operating under, and it's actually why I feel so fortunate that I am able to have a full 50 minutes with my clients, typically weekly over long periods of time, where, a client can get their lab results back and have a one sentence response to their physician from their physician, and then we spend an hour unpacking it all. And what does it mean for them in their lives and in their relationships and all of the facets of what makes them a person, their spiritual life, right? Their emotional life, their psychological life, their embodied physical life, because we are these complicated multidimensional people. And often we do. I mean, I loved what you said, that we are often kind of minimized to a walking shell of a person when our bodies have this, vital job of holding all of who we are.
Yeah. I ask this question to every interviewee. So I'm going to ask it to you. Based on your career, you've dedicated your career to helping people with their relationship to food and body. And when you look at what we do know of GLP-1 right now and where we can project where it's going, where do you see our niche, the weight neutral health, going in 3 to 5 years from now, long term?
Oh gosh. This is I'm going to think on this question. I'm going to think on this question. The short answer is, um, I'm not sure I know where we're headed. And what I really, really do believe is, I really believe this, is that our work is still so necessary, because we are going to have people for whom they don't want to go on a GLP-1, and they're navigating the fact that they're making that choice that maybe feels unpopular, or that they are somehow, out
Resistant and
to
rebellious.
totally way out of the norm. And so they're sort of navigating, that. I mean, I absolutely have clients like that in my practice. We're also going to have people for whom are choose to be on a GLP-1, and they, with all of their heart and soul and all of their being, want to be in a committed, authentic eating disorders recovery. And we're going to be able to work with those individuals in all of the nuanced ways that we do.
Yeah.
We're also going to have folks for whom they go on a GLP-1 and it is the worst possible medication for them to be on. And it has really severe, untold consequences for whom we're going to be on the other side of that, for whom there's been pretty catastrophic damage. And so we're going to be on the other side of those individuals for whom that's their story. And so I see so many ways in which I just don't believe this is going to be the end of weight inclusive care. I think that it has just made our work all the more complicated because it's
Yeah.
added an additional element that is of unpredictability, of accessibility to something that can be incredibly harmful for many individuals. And so one thing I will say that I feel quite strongly about this is that as providers, we have to be prepared to become more comfortable with being in dissonance with clients, of being in dialectic, of being with profound ambivalence, and being able to settle into that and welcome that into the room. Also with internal clarity, an internal compass, an internal sense of what feels like work that I'm on board with versus what feels like work that I'm being asked to do something that is just something that's not aligned with my own ethics. And so I think that there's going to be a real continued internal reckoning and an internal need to get more and more clear inside of ourselves.
I love that. I love that. Like, we have to make our own decision internally as practitioner first.
Yeah.
While holding nuance. And for me, I'll add one thing, having much more deeper and more complex conversation than just what we unfortunately are trained for at the baseline.
Couldn't agree more.
The skill set of counseling and all the various lineage of counseling technique, like we're going to have to be able to have these conversations and do a lot more coaching, therapy work with people, because that's like a group of people will go on this medication, think of it as like that's finally the solution. Like when thinking more general population non-eating disorder, they'll think this is it. Like this is dieting didn't work, but GLP-1 will work. And then we know what is most likely to happen. They'll come back to say, well, that didn't work again. And
it
I think
didn't
we need to
work,
be there.
or and we need to be there. It didn't work, and or it created some problems that I didn't anticipate. I ended up having this medical complication that I didn't know was a possibility, or I ended up feeling a certain way that actually made me feel quite depressed, or that we're going to be on the other side of what is a person's unique experience. And that I really strongly agree that we have to, inside of ourselves, be open, be skillful enough, and to be ready to lean into that kind of complexity with compassion, non-judgment, but as I said, also with clarity.
Yeah. And we need to, like, to me, we need to demand more research, obviously. That's something. We need to look at mental health research, eating disorder research, body image research. We do know that financially there's no appetite for that in the traditional research field. But I think if we want to do some activism, we need to demand for more research that will broaden the outlook of those medications.
That's exactly right. Yeah, it's talking about, for us holding this dialectic, we need to demand it while at the same time appreciating we have always done our work with a real deficit in research and data.
Yeah.
And many people are not so interested because it's not rooted in capitalism. So there isn't money to be gained.
Anything else you would like to share? How can people work with you in all the capacity that you can? Where can people find you? Tell us more a little bit how we can work with you.
Thank you so much for this conversation, Stephanie. I love that you're doing this series. I think it's phenomenal and really necessary. The easiest way for people to find me is just on my website, which is, I'm sure you'll link, which is marcird.com. And I am on social media. I think the place I'm the most, although not even super consistently, is Instagram. And if folks want to hear from me, particularly in a more nuanced way, I would suggest that they join my newsletter, which they can on my website. And I promise not to spam you. I'm actually quite, I think, conservative in terms of the numbers of emails that I send out. But I do have a number of free resources on my website, both for clinicians and for individuals that might be helpful for folks. And I do have a number of offerings, coming out this fall. Going to be holding a workshop actually on the impact on weight-inclusive clinicians holding space for this work around GLP-1s and the impact it's having on providers. I'm having a new course coming out on digestive disorders and eating disorders, so I'm relaunching that. It's fully updated, so I'm up to my eyeballs on that. And then, as I mentioned, my book's coming out this November, so folks will see that. It's a textbook geared towards clinicians who do eating disorders work. So I'm excited for that one to come out.
Thank you, Marci, for having shared 1 hour of your time with me and the listener. And we'll put all the links in the show notes.
Thanks again.
Want to coach behaviors, not bodies? Learn the mindset tool and the method that create real changes? Join the waitlist for the next cohort of the non-diet coaching certification at stephaniedodier.com/waitlist. That's where the real training begins. And I'll see you on the other side, my sisters.